My names are Bikutwala Atukunda, and I hail from Uganda, the Pearl of Africa. This is my story. At the age of 21, I graduated from Makerere University in Kampala. At age 22, I married my wife Dembe, and we had a beautiful baby girl shortly after. For 3 years, we struggled financially. I could not find a job with which to sustain my family, and she resented me for it. On top of that, I had been battling severe mental health issues. After 4 years of marriage, Dembe took our baby girl and left. It was shortly after I realized that what we see in the American films is not entirely fiction. I found myself on my knees, with a gun to my head. My family had abandoned me. I became an outcast in my community. I pulled the trigger. But nothing happened. After being spared from death, I decided to find help, but rather help found me. You see, most people here with mental health issues don't go to a traditional doctor. Many prefer to go to the shrine doctors because mental illness is believed to be a curse. Now, I am 31 years old. After receiving treatment from a Swiss psychiatrist and his team, with time and medication, my health improved. I began deep research into my country's mental health system and found so many shortcomings. But I believe with time and the right resources, Uganda will shine again.
In the developing country of Uganda, located in East Africa, almost 40% of the population, or approximately 11.5 million people, suffer with mental illness, depression being one of the most common. Uganda's mental health system deals with numerous shortcomings that prevent diagnosis and treatment for mental illness. Mental health services have yet to be fully integrated into primary care. The lack of trained mental health professionals has led to treatment being done by unskilled individuals. There's only one psychiatric hospital in Uganda, with a capacity of 550 patients, but at any given time there's as many as 1,200 patients admitted, of which 50% have acute mental illness. Poverty is highly associated with mental illness in Uganda, which is considered one of the world's poorest countries. Countless families cannot afford to work and cannot care for members who are mentally ill or pay for monthly medications. These individuals and their families face exclusions, as many believe psychiatric disorders are contagious. Stigma associated with mental illness is also a significant barrier. Often, those with mental illness are denied access to social service, community activities, development programs, self-help groups, and government welfare. Although there have been important developments in Uganda's mental health policy and services, there remains a number of shortcomings, especially in terms of resources and service delivery.
Currently, there is only one referral mental health hospital in all of Uganda, and although 88% of the population lives in rural areas, 60% of mental health services are in urban areas, which complicates access. The integration of mental health programs is further hindered by inadequate staffing and resource allocation, and a lack of mental health medications available at health centers. Also, despite the development of a mental health bill in 2011 geared towards these newer mental health goals, the bill was not passed, so mental health legislation in Uganda hasn't been updated since the 1964 Mental Health Act, more than half a century old. Although another major limitation is the stigma and lack of education around mental illness, with the majority of citizens believing only advanced diseases and manic psychosis are considered mental disorders warranting diagnosis and treatment. Poor access to mental health education and services has allowed stigma to continue, and many people avoid seeking help, and those who do seek help often lack adequate access to the help they need. This has significant implications for the mental and emotional well-being of all Ugandan citizens affected by mental illness, directly or indirectly, and has a negative impact on all aspects of their health and well-being and quality of life. In recognition of the importance of mental health and current limitations, in 2016, the government of Uganda invested $21 million for the improvement of quality services for mental health conditions. And the Ministry of Health has also begun implementing the Mental Health Gap Action Program as part of a World Health Organization initiative for increasing access to care for people with common mental health and related disorders.
Good morning, Mr. Bitukwala at Kundai.
That is not my name, sir. My names are Bikutwala Atukunda. Bikutwala Atukunda.
A few moments later.
Mr. B, I was just wondering, what do you think your government, the Ugandan government, should do in terms of what steps they should take to combat the critical issue of mental health and mental issues?
Well, first of all, our government should recognize mental health as a serious public health issue. The entire mental health system needs to be reformed.
Why do you say this?
Well, why I say this, in my personal experience, I have seen what my country has gone through, and a lot needs to be changed. Listen, Kiali, in my country, there is only one mental health referral hospital, Butabika, and at Butabika there are only 8 psychiatrists. 8 psychiatrists for 842 patients. In fact, the whole of Uganda, there are approximately 32 psychiatrists. Now imagine that in a population of 37 million people.
Wow, that's definitely some staggering numbers.
That is over 1 million people per psychiatrist. That's a lot of people.
Definitely. So what do you suggest your country does?
Well, for starters, we need to implement strategies to create programs where people are trained to do their work well, to make lasting changes in the system for a very long time. You see, what we have currently is not very practical. Most of it is superstition.
Superstition such as?
Superstition like going to witch doctors to deal with depression, going to churches.
I'm sorry, churches?
Go to the church, yes, they go to church.
Church? What's
People
that?
go to church on Sunday. Don't you go to church? The Christian church.
Oh, church. Well, that's easily said than done. Can you give an example?
Okay, think Muzungu. Look at this for example. Using a psychotropic drug to treat depression just once. Using that drug one time to treat depression is not enough.
Why is that?
Depression is a long-lasting thing. The government should incorporate a continuity of care. That is what is more important. That is where training workshops would come into play. Our leaders need to understand mental health some more, because if they do this, they will see the need to invest in the research. I have done my own research after dealing with depression for years.
The mission statement of Mental Health Uganda is to create a unified voice that influences the provisions of required services and opportunities in favor of people with and survivors of mental illness in Uganda through capacity building, networking, advocacy, and partnership. What are your opinions on this?
These types of organizations are critical to moving forward in the right direction. Do you understand?
Yeah.
Right.
Alright, so they are doing something.
It's something, right? It's something. I can't be ungrateful.
Alright, Mr. B, thank you for your time.
Thank you.
It was a pleasure having you here today.